Circulating levels of myocardial necrosis biomarkers not only correlate with infarct size and ejection fraction, but also predict clinical outcomes after an ST segment elevation, MI. And for that, we all use CK and troponin measurements. But here is a problem we overlook. Left ventricular hypertrophy is attained by hypertrophy of pre-existing myocytes. Such hypertrophy is encompassed by an increase of contractile units and their proteins, of course, including troponin. In fact, it has been shown that compared with normal cardiomyocytes, hypertrophied cardiomyocytes display an increased troponin concentration, but unchanged total CK concentration. Now in JACC, research used that information in a study on the release of troponin after an MI, specifically studying whether troponin is disproportionately higher than that of CK in patients with LVH. The clinical correlate, of course, is that the prediction of infarct size based on the circulating levels of troponin might be overestimated by the presence of LVH. They looked at almost 1,000 patients with ST segment elevation MI and assessed total CK and troponin I. A standard echocardiogram was performed 3 to 5 days after the infarct, and patients were classified into 4 categories according to left ventricular thickness. Here's what they found. Peak CK values did not differ among the LVH categories, but significant differences in troponin levels were found. Troponin concentrations were significantly higher in patients with mild or moderate or severe LVH compared with patients with no hypertrophy. Troponin I was almost 14% greater in patients with mild LVH versus patients with no hypertrophy. These results may have significant clinical implications because troponin release seems to be an overestimation of infarct size in patients with LVH. That overestimation might make differences in post-MI therapy and, for example, might make you think your patient has a poorer prognosis than he or she actually does. This is the first time that a different pattern of CK and troponin enzyme increases have been shown in STEMI patients with LVH. So the next time you treat a patient with an MI, look by echo to see if their ventricles are hypertrophied. If so, the infarct may be smaller than you think. I'm Peter Block, and this is a CardioSource Heart Minute.